Hello class. Today we're going to discuss the importance of evidence-based practice in our roles as nurses, and we're going to review how to perform database searches for evidence using electronic resources. Hopefully you were able to take the survey last week. This is the survey link for SurveyMonkey to take the short evidence-based practice survey. Our course objectives there's 4 of them. We're going to identify the importance of using evidence-based practice in our nursing practice, our day-to-day practice, and either whether it's direct patient care or out of the hospital, or in the emergency room or the operating room. It's very important that we use evidence-based practice. Another quick one we'll go over is identifying some barriers to the implementation of evidence-based practice. We'll talk about a list of databases that are useful in searching for evidence-based practice, and then we'll go over some methods of searching for evidence-based practice in those databases. You know, as nurses, we've always appreciated the scientific method of answering questions. And this method has recently, probably in about the last 2 decades, been used to gather evidence either supporting or refuting our practices as nurses. After the Institute of Medicine's 1999 report entitled "To Err is Human," which found up to 98,000 patients per year may be dying from medical errors, a concerted effort has been made to reduce error and improve practice. In 2003, the Institute of Medicine released an article entitled "Health Professions Education: A Bridge to Quality." This expert panel distilled 5 core competencies to be used in medicine to reduce injury and error. From this landmark report came another initiative also funded by the Robert Wood Johnson Foundation: Quality and Safety Education for Nurses, otherwise known as QSEN. This was a multiple-phase project which began in 2005 and convened experts to develop an education program for nurses that taught the concepts of quality and safety. There are 6 core competencies detailed by QSEN for nurses. Well, these are the 6 core competencies. Patient-centered care involves recognizing the patient or the person they designate as a full partner and in control of their own care. As nurses, we show respect for the patient's beliefs, values, and preferences. Teamwork and collaboration is necessary to improve patient care. This is cultivated by the concepts of open communication, mutual respect between interdisciplinary team members, and shared decision-making. Evidence-based practice involves the most current, most evidence-supported practices along with patient preferences to improve patient care, safety, and satisfaction. Quality improvement involves using data to monitor and assess patient care systems for adequacy and opportunities for improvement. Safety realizes the importance of providing a safe healing environment for the patient and minimizing risk for error that the patient may encounter in the healthcare setting. You know, it's said that there may be up to 40,000 medical errors per day in the United States. Informatics involves the use of information and technology to communicate, manage knowledge, mitigate error, and support decision-making. National patient safety goals are developed by the Joint Commission, and they're based on the reporting of sentinel events across the nation. It's designed to choose areas that will improve patient safety and require hospitals to show compliance in these areas, which is tied to reimbursement of the hospitals. All of this information has the concept of evidence-based practice at its core. Evidence-based practice is the driver of safe, efficient, and cost-effective care. Using evidence-based practice is important because it saves lives, it ensures better care, and improves patient outcomes. There's been several studies that identify barriers to evidence-based practice. And these are some of those. These are the ones that Brown et al. Found in their study. And they're actually ranked in order of importance, ranked by nurses that they evaluated or surveyed. So insufficient time on the job to implement new ideas, nurses not having the time to read research, not having the authority to change patient care, or maybe there's other staff not supportive of the implementation of evidence-based practice. Nurses being unaware of the research, relevant literature not compiled in one place, so there's no real library or access to the literature. Physicians that won't cooperate with implementation, not capable to evaluate the quality of research. Research results are not generalizable to the setting that the nurse works in. And then isolated from knowledgeable colleagues. Dr. Forrest, when this becomes live with a class, this would actually be the same list in the order that they put it in prevalence from the survey. So the survey results will be on this slide, but right now, since there's no survey results, I just replicated the slide. One of the most often cited barriers is the nurse being unable to find evidence-based practice research when using a database search engine. Dr. Forrest, this slide will show the survey results for the class of which databases they use to find evidence-based research. The data that I use for this chart is fictitious for the time being. All of these search engines can provide you with articles and/or guidelines. The key is being able to access the discovered information. Your school or institution may have access to the information contained in these databases, or be able to order the material. There are keys to finding information in these databases. The first key is to come up with a good question, and then we can, from our question, determine key terms to search by. This question is very specific, and then we'll use it to list some specific terms or key terms that we could search for. So the question is, how does hourly rounding by nurses affect the incidence of call light usage on a medical surgical floor? So some of the key terms that we might be able to get out of there is nurse or nurses or nursing. We could use rounding or hourly rounding or rounds, medical, surgical, maybe call light or call light usage. The more terms we use, the more refined our search results will be. When we look at refining our results, we can use dates. Most educational institutions recommend trying to find research that is not older than 5 years since the publication date till today. Full text availability might provide you with articles that you can read now. If you are sending off for the articles, then you would not want to use this feature. Medical subheadings or mesh are major groupings of data by subject. We could also add more keywords, and we could use Boolean operators. Let's talk about Boolean operators. The Boolean operators are using terms and, the term or the term not. For example, you could use hourly and rounding or hourly or rounding. Which one of these examples do you think would provide more results? Well, it would be hourly or rounding. Obviously, the or expression expands the search, and the and expression limits the search. We can further refine our results. If we put nurse or nursing, so we'll get both results for that. Hourly and rounding would refine that result. And then we could add call light, and that would refine our results to only articles that involved call lights. Now imagine if you got a whole bunch of responses, but many of them involved being in a long-term care facility and not so much in a hospital setting. Well, we could put not long-term care, and that would refine the search and take out the anything that had long-term care in the key headings. So let's use some of these in an actual search. So here's a search that we did in CNOL, the database for nursing, and we used nurse or nursing and rounding, and we got 160,314 results. Well, that's quite a few results, so let's see if we can refine it a little bit. Now we still have nurse or nursing, hourly and rounding, and not long-term care. We've made our results down to 36. And you can see that it's down in the left-hand corner that it's refined by the year. So we have 2006 to 2014. So basically in the last 8 years we're seeing the information found. This chart shows the levels of evidence that are available. The most dependable types of evidence are systematic reviews or meta-analysis. The least amount is clinical reference text, or what we see a lot of in our search findings is case reports, case series, and practice guidelines. The more you move to the tip, the upper tip of the triangle, the more concrete the evidence is. So in summary, we have identified how important it is to use evidence-based practice as nurses. Its use can reduce error and improve patient safety and outcomes. There are many perceived barriers to implementing evidence-based practices. As nurses, we need to work collaboratively with other medical professionals and administrators to overcome these barriers. There are several databases that are useful in finding evidence-based practice research. Using Boolean phrases can help us limit our finding to a more manageable mass of information to sort through and help us be more specific in finding answers to our evidence-based questions. Well, thank you for your attention, and that concludes this segment of the lecture on evidence-based practice.